presenting a paper on comparison of time taken to read the stereo acuity plates between medical undergraduates with and without refractive error. The medical profession requires good stereo acuity while performing fine skilled near work. Suboptimal stereo acuity hinders the performance of such tasks. The study conducted by Biddle M. et al. Showed evidences of not only reduced but total absence of stereo acuity in practicing surgeons when tested for the same. So, assessment of stereo acuity among medical undergraduates is necessary. The Netherlands organization TNO Plates are routinely used for assessment of stereopsis and suppression. In this study, medical undergraduate students have been assessed for the level of stereo acuity and the duration taken to interpret the TNO plates by emmetropes and those with corrected ametropia was documented and analyzed. It was a cross-sectional observational study conducted in a government medical college among 400 medical undergraduate students from April 2021 to June 2022 after prior approval of the Institutional Human Research and Ethics Committee. Consenting participants were enrolled for the study. Students having any organic ocular morbidity and like corneal opacity or traumatic or developmental cataract or any retinal pathology were excluded from the study. After noting the demographic details, participants were inquired about any ophthalmic complaints and history of spectacle or contact lens use was noted. Distant visual acuity and near vision for each participant was assessed with Snellen's illuminated chart and Roman's chart respectively. Cycloplegic refraction was done with those with subnormal vision and which was followed by post-mydriatic testing. Best corrected visual acuity was documented, followed by testing for stereopsis with the TNO random dot stereo acuity plates. The time taken to read plate 1 and plate 5 was recorded for each participant in seconds. The data was entered in Microsoft Excel 10 and analyzed using SPSS version 26 and unpaired t-test was applied. Out of 400 students assessed, 257 students had refractive error. It was observed that most of the emmetropic students were having normal stereopsis, and of the 79 students who had abnormal stereopsis, 77 had refractive error. One student was diagnosed with anisometropic amblyopia, and 6 students were having abnormal stereopsis, and they could not read plate 5. So 7 students were excluded from the study that was the analysis of data for the time taken that was done. We found that average time taken to read the gross stereopsis plate, the plate 1 was slightly more in those with emmetropia than in emmetropes. However, this difference was found to be not found to be statistically significant. Statistically significant difference was found in the time taken to interpret the fine stereopsis plate, that was plate 5, between those with corrected ametropia and the emmetropes. Most researchers in the past have shown that uncorrected refractive error is a notable cause for decreased stereopsis. All kinds of refractive error lead to a visual blur, resulting in decreased binocular function with low sensory fusion. In this study, majority of students had good stereopsis, which was higher as compared to other studies, as 1/3 of our participants were emmetropes, while in other studies, students with refractive error were enrolled. The analysis of time taken to read plate 1 and plate 5 of TNO chart and its comparison between the emmetropes and ametropic candidates was done for the first time to the best of our knowledge. We observed that both emmetropic and those with refractive error took approximately 30 seconds to interpret the gross stereopsis. However, those with corrected refractive error took almost a minute to read the fine stereopsis plate, while it takes around 35 minutes for emmetropic candidates to read the same. We suggest that subjects with refractive error should be given at least 1 minute to read the TNO plates, and they should be motivated to focus and for a minute to not record false low stereopsis. The candidates with delayed response should be encouraged to view constantly and focus for a minute at least. And this information gathered will also help us to assess stereopsis in children, pediatric age group, and they tend to lose focus and they don't verbalize easily, so they should be given at least 1 minute before we reach a conclusion. Thank you.
Were most of your patients myopes?
most had a compound myopic astigmatism, and then there was simple myopia.
So was there a difference between those with myopia and hypermetropia? Because you've just corrected their myopia, you said. Some of them must have been corrected prior.
Yes.
Some were already wearing glasses. Did you
Huh.
find a difference between those who were already wearing and those who had to adjust to new glasses?
No,
Or
ma'am,
between
those
myopes
with,
and
no,
hypermetropes?
that was not. There was no difference. Those with.
Or have you checked it, or
yes,
there was no
10
difference?
students were like they did not know of their subnormal vision, and they were correct. They were diagnosed with refractive error at the time of the study, and there was those who were excluded from due to abnormal stereopsis. They already had refractive error, and they were using glasses.
So how it is useful to the students?
So
You are-
it can give a perspective about the specialties in which they want to in
Pursue.
future which they want to perceive. Like the study that was conducted by Biddle and et al. It showed that most surgeons they on using visual aids like the microscopes, they perform almost equally well in both this equal in both what do you say the
Okay,
equal
thank you.
as those without refractive error.
Thank you, thank you.